More hardship in 11 months than most of us face in a lifetime. Nathan, 11 months old, born with a genesis. The band connecting the two halves of his brain is absent. Hearing impaired, vision impaired. At times during seizures, stops breathing. Mother works. Dad works 12 hours a day. 4-year-old brother at home. Grandparents help with care, along with nurses. Mom says he's a darling baby. Nathan is one of 350 Medicaid patients cared for by home care nurses, so he can stay at home. Eric, 36. When he was 6, sitting in the back seat of his mother's car, a truck crashed into the back. Brain injury. Left him paralyzed, quadriplegic, tracheotomy, feeding tube. Has had same nurse for 5 years. Mother says nurse kept him at home and that she kept him alive. Sharad, gunshot wound 5 years ago. Left him paralyzed from the neck down. Tracheotomy, ventilator. 2 years ago, Mother fell ill. Refused to seek treatment, saying she was afraid if she wasn't there to care for him, her son would be put in an institution. Somehow, nurse worked it out. Mother had surgery, house burned down. Somehow, nurse worked that out too. Jessica, 22. Cerebral palsy, grand mal seizures, heart disease, legally blind. Oxygen 24 hours a day. Food and medication through a tube. Mother works. Sister at home. Karaz. His father came into his room to kiss him goodnight. The child wasn't breathing. Dad gave CPR. Too late. Permanent brain damage. Doctors, friends, preacher advised parents to pull the plug. Mother said no. Said he cheated death for a reason, and God knew why. After he came home from the hospital, nearly died twice. Nurse saved him. Parents separated. Mother works. Ted, 41. Born paralyzed, waist down, heart condition, and seizure disorder. Doctor said he wouldn't live past 6. He graduated high school. Mother, who had 4 heart attacks, cared for him until 2 years ago. Then pneumonia left him on ventilator. That's when she asked for nurses. Father died in 2007. Same year, nurses came. Trish, struck by car when she was 10. 38 now. Can only move her face and neck. Tracheotomy, oxygen, 30 medications. Fears being put in nursing home. Told nurse people who separate families have no conscience. Jaylon, 8. Hypoxic ischemic encephalopathy. Too little oxygen to brain. Can't chew, can't swallow, can't speak. Father deceased. Mother works 2 jobs. No other family. Mother sleeps by child's bed. Amir, 1-year-old. Apert syndrome. Skull peaked. Put pressure on brain. Fingers and toes fused. Mother works. 2 other children and mother share 1 apartment. Matthew, 3. Pierre-Robin syndrome. Jaw didn't form in womb. Tongue blocking airway. Constant oxygen. Father serving in military. Mother works. Single mother. Jasmine, 20. Rett syndrome. Child normal till 4. Now has spastic quadriplegia. Seizure disorder. Scoliosis. Uses pump for medication, tracheotomy last year. Actually attends high school, accompanied by nurse. Mother works. Jessie, grandmother, MS, completely paralyzed. chronic pain. Communicates by eye movement. Husband says she made him promise not to put her in a nursing home. And he hasn't.
That's 11 of the 350 patients in this program. It's the smallest Medicaid service, but it allows these children to stay at home rather than being put in an institution. The hours these nurses spend caring for these patients are being cut, and the nurses' pay is being cut. One top Medicaid official told me putting them in nursing homes is cheaper. I could argue that, but that's not the point. The point is, taking these children away from their homes and their families is wrong. I want you to do something. I want you to send 3 emails, one to Governor Beverly, Perdue, one to Secretary Laneir, Cansler, and one to Medicaid Director Cregon Gray. Ask them to stand up for these families and not take away their home care nurses. Thank you.